And welcome back to the Ask Dr. Mather show alongside Dr. Brian Mather. I'm Dave Erickson. Today's topic has to do with common symptoms that people see on a regular basis due to their regular lifestyle. And what is the average person who walks through the door at your clinic? What are they complaining about?
I would say probably the most common complaint that we see that walks in the door would be lower back pain. However, most people don't fully understand the causes of the lower back pain. A lot of times people come in and they think they strained a muscle or they might have a disc herniation in their lower back. But more often than not, probably 75+% of the time when a patient walks in with back pain, it's actually coming from their pelvis. So we have, as human beings, our pelvis is made up, and at the back of our pelvis we have two joints called the sacroiliac joints, or what you'll hear me refer to as your SI joints. And if you just take your hands and reach around to the back of your waist, you'll feel two kind of bony bumps back there on each side of the spine, and those are the tops of your sacroiliac joints. And those joints actually can lock into place, and they quit moving like they're supposed to. And when those joints lock into place, it creates a ton of changes throughout your body, and commonly creates the lower back pain that you're suffering from, as well as hip pain, hamstring problems, knee problems, ankle problems, IT band issues. So sometimes you don't even have to have back pain. You can have any type of pain in the lower extremity, the leg, that was not due to a trauma, and it just kind of showed up. It more often than not is due to the pelvis not functioning the way that it's supposed to.
How does this fit into your specialty or some of the cases that you treat most regularly?
Because people typically come in thinking I have back pain, so let's go to the chiropractor for back pain. Given that we are able to diagnose this sacroiliac problem, and we've been very, very successful at treating the sacroiliac problem, it's probably one of the common things that people go to different doctors for, and a lot of times they're not really getting great success. They might have this pain ongoingly, or it keeps coming and going. Sometimes we'll see patients that come in and it's a brand new problem in the last week, but more often than not, it's a problem that they've had for months to sometimes even years, and they haven't found a consistent option to treat it, or they kind of have decided that, well, this must be normal and I have to live with this. And so part of the things that we look for are ways not only to diagnose it correctly, to treat it correctly, but to give patients options to have tools from home to treat it ongoingly, so that they're not dependent upon our care, having to come into the office consistently for treatment. So I give a lot of exercises and a lot of things for patients to do to try to minimize their trips into the office, so that they're able to treat this stuff for the most part on their own.
Now, SI issues, that's not necessarily a sports-related condition, is it?
It's a human-related condition. I see it across the board no matter what you do. I would say probably 80 to 90% of our patients at some point or another in their life will experience this type of an issue. It's prevalent in athletics with sports people because of all the repetitive motion in athletics, but it's also prevalent in daily life as well.
So are there certain athletes that will experience this more than other athletes?
Great question. I think our running athletes probably experience it more than anybody, which for most sports, you run in almost all sports. But then you take like golf, for example, where you're not running, but there's so much torque that happens while you're swinging that you see it equally in those sports. So as you asked me that question and I started thinking deeper about it, I think I see it across the board in almost all sports.
Wow. And is there a certain age range where it's more prevalent?
I see it in all ages. I see this in younger athletes as well, but I think it's most prevalent probably in the 20 to 40-year-old athlete, and I think more because in that age range, you're seeing a higher level of competition. Your body is starting to break down in age. So, while we see it in high school athletes, it's certainly not as common in a high school athlete as it is maybe with a 30-year-old individual that's still playing athletics or still training because they don't generally give themselves appropriate recovery time. They're pushing the envelope pretty hard and still thinking that they're 20 years old and they can conquer the world. So I think that's why we see it more prevalent in that age group. But I do see it from young athletes all the way to geriatric patients.
So does your physical condition or how muscular you are have anything to do with whether or not this will happen to you?
And it's not as much as the bigger muscles you have, the less likely, but it's how effective do you have those muscles working for you. One of the biggest things that we see with sacroiliac problems is when the sacroiliac joint locks into place, you often lose control of your glutes. And so your gluteal muscles get inhibited and they don't fire at the right time. They are your primary stabilizers of your pelvis. And if they don't do their job at the right time, then the system can't function correctly. So you might have strong glutes. It's very common in like triathletes and runners where they do events that really work their glutes in running and biking and swimming, yet they overwork their glutes to the point that the glutes get fatigued and they shut down, and then those joint mechanics have to take over and compensate and they lock into place. So someone can be very muscular, very active, and their muscles just don't do their job at the right time. So we spend quite a bit of time retraining the musculoskeletal system to get those muscles to do their job at the right time to stabilize the system so that they can continue to go on without pain.
I'm sure people have a lot of questions for you. This is a great topic. If you have a question for Dr. Mather, use the hashtag AskDrMather on Facebook, Twitter, or YouTube. Thanks very much, sir.
Thank you.